Hello, guys. I'm Patrick Amunye. I hope you all are doing well. Today's video has the following topic: how can pharmacognosy improve the living conditions of Africans in 2022? And to answer this question, we have the privilege, the honor to have as guest Dr. Daniel Akingbolabo from Nigeria. He will be connected with us in some minutes, so please be patient. I want to use this time to let you know why Afrik-innovscience exists. Afrik-innovscience is a platform present on YouTube, Facebook, which has the goal to promote science, technology, engineering, and mathematics in Africa. And to promote science, technology, engineering, and mathematics in Africa, we invite people like professors, engineers on the platform on Afrik-innovscience so that they can share their knowledge with us. So, Dr. Daniel Akingbolabo is present with us right now. Hello, doctor.
Good evening, my brother. Hope you are good.
Thank you very much. Thank you very much to be present with us right now on Afrik-innovscience. I hope, or we hope, that you are doing good.
Yes, my brother, I'm fine. And you know, this is the festive period. We are in a good mood. Everybody is in good mood because even the weather is cooperating. So thank you very much, my brother.
Thank you very much. I hope everybody in Nigeria is doing well. How is the population in Nigeria? Our brothers in Nigeria.
Well, you know, everywhere is fine. It's just that, you know, just like this pandemic that is
Yeah,
affecting everywhere. Even Nigeria is not left out, but we thank God. God is giving us breakthrough, and you know, this issue of this vaccine that was discovered has really
yeah,
relieved the body. So everyone
yeah,
is doing fine. And unlike last year when we experienced complete lockdown, we're a little bit
exactly.
freer now, and that's movement.
Yeah. So we thank God, and we are sure that pharmacognesy
Okay.
is used very well in Nigeria and is helping the population in Nigeria to cope the situation we are facing right now. So please, can you introduce yourself for the people who don't know you? Who is Dr. Daniel Akingbolabo?
Okay, thank you very much, my brother. My name is King Akingbolabo Daniel, a Nigerian and a chemist, industrial chemist, with a strong desire in drug discovery. And that has really led me to even further in academics and in research work in the field of pharmacognosy, which has to do with drug discovery and with specialization in formulation. Because mine is to discover the drug and to turn it to what is useful in fighting physiological conditions that we are not expecting, which we call diseases. So that has been my passion.
Thank you very much. That's very interesting, very and great. So your
Thank you
aim
very much.
is to develop drugs. Wonderful,
Yes.
wonderful. So please, can you define the word pharmacognosy for us? It's a word that
Okay.
we don't usually hear in our day-to-day life. Please, what is pharmacognosy?
Yes. But my brother, you know, when you hear pharmacognosy, you'll be thinking it's an abstract science, but actually
Yeah,
it's not. If I may ask you that, have you taken vegetable this week? Have you?
okay.
Have you taken any vegetable or fruit this week?
Yeah, I've been taking vegetables. Yeah.
All right. And you know the best way of preparing it so that the nutrients won't be lost, isn't it?
The best way to cook it, I'm not sure I know.
Yes. So my
Maybe you
brother,
are going
that's
to
what I'm
tell us
saying.
today.
Everybody is a pharmacognosist in one way or the other, but the word
Wow.
was firstly used in 1811 and was
It,
consistently in use till 1815. Although the act of pharmacognosy has been in existence several years before that. And the word
wonderful.
pharmacognosy is from two Greek words,
Mm-hmm.
pharmakon and gnosis. Pharmakon
Okay.
means um, pharmakon. When we look at the word pharmakon, it means drug, from pharma, it means
Yeah.
drug. And gnosis means knowledge or to
Mm-hmm.
actually conceptualize, that is to study, to experiment, to recognize. So when we're talking about pharmacognosy, it's two Greek words joined together, pharmakon and gnosis, which simply means drug discovery from natural sources.
Wonderful. What a good definition. I think the people who are viewing this video right now, who are listening, us have understood what pharmacognosy is. So it's the production of drugs using natural plants. That's it, right?
Exactly. Yes,
Wonderful.
yes, yes.
So why did you decide to do first
Okay.
of all chemistry and then focalize on pharmacognosy and have your PhD on this topic? What motivated you to do that? Is it that you
Oh,
wanted to solve a particular problem in your society? What motivated you?
okay, thank you very much. Initially, I need to tell you the truth. I really don't have passion for pharmacy because pharmacognosy is one arm of pharmacy. But in my third year as a chemist, undergraduate days, I was
Yeah.
given a particular topic, and that topic has to do with writing on medicinal plants, reviewing medicinal plants that have been used to manage diabetes in Nigeria. So during that time, I was opportune to see a lot of informations, my brother, a lot from Nigeria alone, not even from West Africa, a lot of publications, wonderful outcomes from Nigeria. And to my surprise, I saw that some of the plants that is our day-to-day food is actually a drug. My brother, if I should tell you that okra has anti-diabetic activity, will you ever believe that? The
No.
okra that we the okra that we eat every day. What of if I
Wow.
tell you that shower shop, Anona squamosa, has anti-diabetic property? Will you ever believe? Even mango has
Wow,
anti-diabetic
really?
property.
Even mango. So everything we are seeing, we are eating, everything is a drug.
You know, that's the reason why I said you and I, we are pharmacognosy in one way or the
Wonderful.
other. You understand? We're pharmacognosist. So that zeal, with that zeal, I saw all those things and I was like, wow. So all these fruits, all these plants, vegetables that we eat every day, they're actually drug. But what we don't know is the best way of preparing them so that all the metabolites, the constituents that has this activity won't get lost. I think that's the only
Mm.
remaining thing. So with that zeal, a thought came to my mind that it would be a wonderful thing if we can have all these fruits, all these vegetables in a form that everybody can use and in a form that the activity that these plants possess will not be lost. So with that zeal, in fact, I've never heard of pharmacognosy then. So I started
So you have never
researching and
heard about pharmacognosy before
yes,
doing
before
it
that time.
yourself?
Yes, so it was during that time I had a discussion with my brother, and he
Yeah.
said there's one particular harm in pharmacy that is pharmacognosy.
Okay.
Initially, I taught organic chemistry or natural product chemistry will be the best place to go. But
So
getting to
is
know that
there?
we have, yeah, but getting to know that in pharmacognosy we have several harms. It has to do with drug discovery from natural sources, whether from
Yeah.
marine, from zoo. Once it's natural sources, we are
Yeah.
good to
So
go.
is there a
So,
different? Yeah, yeah. Please go on, go on. Just continue.
all right. So that's why I decided to venture into cognosy. And on getting to cognosy, I discovered that it is a program that is loaded, and it has different applications in our day-to-day activities. So
Wonderful, wonderful,
that's one of the reasons why I decided to venture into that course, to the extent of having the PhD, because I have the zeal
wonderful.
of not only discovering the drug but formulating it as well.
That's great, Dr. Daniel. Imagine if I just take mango like this and then I
Okay.
extract the material, I extract what is really important in the mango, what can help me to produce a drug. If I can just
Okay.
take a pineapple, everything around me, everything I eat every day, if I can just extract the substance which could be used for the drug. Oh, how wonderful it is. But maybe
Exactly.
it's just theory, Dr. Daniel. Are you sure it is possible to remove any substance we need from this food and natural plants to use as a drug? Maybe there are so many problems you face in your day-to-day life as a researcher in Nigeria. Is it possible to produce these drugs like you wish? Because when we hear you,
Hmm. Hmm.
we can understand that you have the will, the motivation, but surely there are so many difficulties you face every day. Please, can you
Yes,
tell us more about that?
you are very correct, because it's easy to talk about drug discovery, and it's
Yeah.
easy to convince people to come to that field. But I must tell you the truth. Like one of my teacher used to say, he said, when something good is very easy to get, then everybody will have it, and there won't be room for innovation and discovery, which is actually true. Anything good must comes with challenges. Hope you believe that.
Yeah, I believe that everything good comes with challenges. That's sure. If it's too easy,
Exactly.
then it's not good.
Then everybody will have it. You too will have it. So there won't be room for
Yeah,
innovation. So in
yeah.
this field, I must tell you the truth. The challenges that we are facing in Africa. I might not be able to talk about Africa in general. Let me talk about Nigeria and West Africa.
Yeah, yeah,
The
that's good. I
the
think it's very
challenge
important to talk
yes,
about Nigeria. Yeah.
it has to do with tools. There's some equipment that we use there's some equipment that we use. One of them, for example, that in Nigeria we don't have. As big as Nigeria is, we don't have that equipment. Yes, those that we have are damaged, and it
Wow.
takes a lot of funds to get it repaired. In fact, it's not even good to repair. The best thing is to get another one. So that's the problem that we've been facing. And through that, we've been robbed.
Really?
Yes, do you want me to explain that?
No.
Okay, through that, we've been robbed. What I mean is that, we have all these medicinal plants,
Okay.
and these plants comes with unique activity that is undeniable anywhere in the world. But just
Mm-hmm.
because we don't have the equipment to get that active ingredient out.
But is it complicated to have the equipments? You know the equipments you need, and then you can maybe organize a crowdfunding, or you can just ask to the authorities that you need them. Maybe the people who can afford this equipment don't know that you need the equipment. So
Okay,
why
well,
don't you have the equipment? That's what we want to know.
okay, the equipment, well, the equipment is something that we can get. In fact, in some countries, some
Yeah,
third world countries that I've been to, they have
yeah.
museums for all these equipment. You know, they keep the older one and they have the recent one. But the challenges that we have in Africa, I would say, is loss of priority. We
Ah,
prioritize a lot of things. Even you will see that science and technology in Africa as a whole is not developing as expected. This is because we prioritize. Okay, for example, if we should, let's digress a little bit. The amount of dollars that we spent on our election in Africa, if we sum it together and we invest half of it in science and technology, my brother, you too, you know what will happen. There will be a tremendous development. But just
yeah.
because there are a lot of distractions, we are distracted, let me put it like that. And
So
another thing
yeah,
is that in Africa, in Africa, there's need for the researchers in different fields to collaborate.
exactly. That was
Because
my
that would,
question. You appreciate my that could be my next question. My your appreciation regarding the collaboration between researchers in Africa. So how do you
yes.
see the collaboration between researchers in Africa? Are you satisfied or
Well, we are trying our best in Africa, but I'm not yet satisfied. We can still do more. There's room for improvement. We should we should encourage. Another thing that we should do is that we should encourage young researchers. All those professors,
yeah, yeah,
those authorities in different fields should encourage the young researchers. Like, okay, there was a day that I went to a professor's office. Do you know that the man stood up to welcome me? And I questioned him that why we use stand up to welcome somebody like me. Then I had masters. And he
yeah?
said it is difficult to predict where the young ones will reach in life, the peak they will reach in life. That one
Really,
cannot
the
predict
young
it.
researchers
Yes.
or the young as a whole, the youngs as a whole.
Young researchers, I must tell you the truth. In fact,
Yeah,
there was
young
then
researchers.
I
Wow.
took yes, I took one idea to him and he said, my brother, this is a good idea. Go and develop the proposal. So that's
Uh,
just it. If older one and younger researchers can
yeah.
collaborate easily and freely with authorities in different fields in
Mm-hmm.
Africa, I think that will break a lot of barrier and that will bring a form of encouragement amidst all the
Wonderful.
limitations that we have.
Yeah.
So,
We hope that with time, the young researchers in Africa in general, we collaborate together. We hope that. Please let us continue to speak about your work in the pharmacognosy
okay,
field.
okay.
Um, have you discovered or are you working on a drug right now which can cure any disease in Nigeria or in Africa? Or is it secret?
Okay, thank you very much for that question. And
Yeah,
in Nigeria, I've been opportune to be in different groups, to belong to different groups. The groups that
yeah.
has worked on drinks that act as nutraceuticals, this to
Mm-hmm.
suppress stress for stress management. I've also worked
Yeah.
personally on a particular plant which we can use effectively to manage PCOS,
To
polycystic
manage
ovarian
what?
syndrome.
Excuse me, I didn't hear very well.
Polycystic ovarian syndrome, PCOS,
Wonderful.
is a kind of metabolic syndrome that affects women, most especially premenopausal women.
Wow.
And yes, and it could
So you have been
predispose them
working
to
on a
cancer.
plant, on a drug which can cure that.
Yes, to the extent that I've been able to isolate the active constituent of a particular plant that possess this activity. And at the same time,
Please, can we have
when
the name of the plant, or is it's like secret? You don't want to
my
tell it right
my
now.
brother, my brother, why I can. The plant is indigenous to us in Africa. The plant is Kigelia. I don't know whether you've heard
Gigelia.
about it before.
Is
Yes,
it
the
the
fruit.
scientific name or is the English name of the plant?
The common name I can't remember now because it has
Yeah,
several common name, but the
yeah.
botanical name of it is Kigelia africana. Even from the name, you know that is our own.
Gigelia africana. So, guys, have
Yeah.
you heard the name Gigelia africana? It's a plant which has been used by Dr. Daniel Akingbolabo to cure a disease which, or a sickness, something like that, which happened in women. Yeah. Okay,
Yes, and there's
that's a
and there's
very
another.
very good news for us. We have learned
Yes,
something.
yes, exactly. Thank you
Wonderful.
very
Yeah,
much.
please go on, Dr. Daniel. Yeah.
All right, and
So,
there's one particular research that I did for my master's, which is on a particular plant. That
yeah,
plant in my part in Nigeria, they
yeah.
use it as cane to correct us. It's used as cane.
Asking.
Yes, yes. The plant is used as cane, but
Yeah,
fortunately, I got to know that the plant could be used to manage diabetes.
yeah.
And the plant is
Wonderful.
Glyphia brevis. For those who are interested in continuing the research, the plant is Glyphia brevis. In my language, in my area, we call it Atori. It's a cane to flog children.
Wonderful. Dr. Daniel, I have a question right now. Do you
All
feel
right.
like your work in this particular field, because I want to underline something, this pharmacognosy field is very, very particular. No,
Okay.
not everybody can work in this field, I'm very sure. Do you feel
Yes.
like you are recognized by your peers in Nigeria, in Africa in general? Do you feel like you are recognized? Do you feel like your work is recognized enough where you are?
Yeah. Yes. Cognosy. In fact, we have a lot of people, a lot of authorities that are recognized worldwide. One of them that I know is late Professor Shofowora. He's a pharmacognosist. And I must tell you the truth, he was consulted
From
one time.
Nigeria? Is it?
Yes, from
Sorry,
Nigeria.
from Nigeria. Okay.
Yes, he was contacted one time to write a whole chapter on medicinal plants in Nigeria, in Africa.
Okay.
And the book is a very big book, and it's one of the textbooks that is being used worldwide in the field of pharmacy. Then we have a lot of
Wonderful.
authorities. We have Professor Moody, we have Professor Ajayoba, we have Professor Elujoba, and we have a lot of professors, a
Wonderful.
lot of authorities
Wow,
in
there are
this field that
so
their
many
work.
professors from
Yes,
Nigeria. I know
I
the
have
Niger.
people,
Yeah. I know
and
Nigerians are
also,
very, very intelligent.
oh, thank you very. Actually, it's Africa. We are smart and
Yeah,
intelligent.
Africa in general. Yeah,
Yes, African. Anywhere we find ourselves, we always distinguish ourselves.
yeah,
And
wonderful.
and
Yeah.
even in Africa, I have friends from other country, Cameroon, Ethiopia, that we've
Oh,
met in a
Cameroon.
conference, and our work
Mm-hmm.
is has been presented,
Yeah.
and the work was applauded.
Mm-hmm.
So that's to tell you that, and the fact that we have a lot of medicinal plants in Africa, I hope you know
Mm-hmm.
that a lot, to the extent that
Yeah.
I have somebody, a particular lab, they are
Mm-hmm.
requesting, they sent a mail that I
Mm-hmm.
should assist them in collecting our plants and I should send to them.
Wow. So
So
you
the
are
fact,
helping them to do their work, to do their project. Yeah.
yes,
Wonderful. Yeah.
actually, that's why I said we need collaboration. even with
Collaboration, yeah.
with yes,
Yeah,
with
that's very
researchers
important.
in different field. In fact, there's
Yeah.
one particular work that I was opportune to be the part of the team then. The product was formulated and we got approval for clinical trials. And you know, for clinical
Mm-hmm.
trials, we need a doctor, a consultant to be part of the team. We need different people in different fields to be part of the team. We need public health analysts to be part of the team. So all these people were invited to join the team, and they happily joined, and the work was successful. So
And you
in
also
Nigeria,
need patience. Volunteer. You also need patience who
eh,
will
eh, who will
use these
volunteer?
drugs.
Exactly,
And
exactly.
then
So
when you collect the data and then you analyze them, then you can have some conclusion if everything is
exactly,
okay.
even statistician was invited to the team to also assist with data
Yeah,
analysis and the rest. You know, we cannot do
exactly.
everything. I can go to the
Yeah.
field to collect, extract,
Hmm.
isolate, then
Yeah.
formulate, and still have time to do other things. No, it's not possible.
Yeah.
And even if you
Please, I
know,
have
if
a
you check,
question before you continue. Please, I
okay,
want to know when you do like your clinical trial in Nigeria, in Africa, and then you
okay,
have your conclusions. In your
okay,
conclusion, you say, okay, this plant uh, can have this drug, and this drug can be used in real life. Do you feel like your conclusions are used in other parts of the world, like in Europe, like in America? Do you think your clinical trial can be accepted in other parts of the world?
yes, my brother. You know, that one can easily be monitored and also be confirmed. African researchers have received a lot of citations, which are
But
evidence.
please, before you finish,
Okay.
African researchers have received also prizes, awards all over the world. Yeah, that's okay.
Yes.
But my question
Yes.
was the clinical trial you are doing in Nigeria, you take it,
Okay.
you take the data, you take everything, and then maybe you come here to Germany where I'm right now. You
Okay.
come to Germany.
Okay.
Do you think your
Okay.
data, your conclusion, everything you have, your analysis, your documentation, everything can be accepted in Germany, for example, without any modification, without any judgment, without any that the data is used just like that 100%, because the reverse is true. When you take the data,
Mm.
the
I,
clinical trial in Europe or in America, and then you go to Africa with them, they are accepted 100% most of the time,
okay.
most of the time.
Okay.
Yeah, please, can you tell me if your
Ye-
clinical trial can be accepted in other parts of the world, developed countries, without any problem?
Yes, my brother, because what we do is we use generally accepted procedures which cannot be denied. You understand? It's
Okay.
accepted, the result is accepted everywhere, anywhere in the world. And also, just to confirm that the clinical trial, any clinical trial that is being conducted in Nigeria, most of them are published in a reputable journal.
Yeah, yeah, yeah,
Yeah,
yeah.
and for it to be accepted and to be published in all the, you know, it takes a lot rigorous is a rigorous process to get a journal or a manuscript being published in reputable publishing house.
Journal,
I must say,
yeah,
you know, we have a lot of reviewers across the globe that will look into it, question it, ask a lot of questions, and make suggestion if possible. So for it to be generally accepted and to be published, then the results, those that I've seen, you understand, they are generally accepted. And
yeah. Wonderful.
some of the work have received a lot of citation. So
Yeah,
which to me
wonderful.
confirms that the work is
Yeah,
not below standard and is
wonderful.
accepted
That's a
anywhere
good
in the world.
news. It's true that I've heard sometimes that researchers in Africa have been cited in some journals all over the world. I've heard that, yeah. Just that I was not sure if the clinical trial done in Africa, for example, will be
Okay.
used 100% in other parts of the world. So I really appreciate what researchers in Africa do, because you guys, you don't have all the materials you need,
Exactly.
yeah, you don't have all the equipment you need, but you can have results in most
Hmm.
of the research you do, and that's what I appreciate.
That's
I've
nice. You can say that
yeah,
again.
yeah, I've interviewed, for example, a researcher in from Cameroon. Her name is
Okay.
I've forgotten her name. I've interviewed
Okay.
her. What did she do? She extracted a substance from a plant to
Okay.
produce a bioinsecticide
Wow.
against
Wow.
malaria. Yeah, yeah,
Okay.
yeah. That's
Okay.
something which
That's nice.
is very, very interesting. And I've been in her laboratory at the University of Douala, and I've seen
Wow.
that the equipment she's using are not the best equipment in the world, but she could
Exactly.
do interesting things. That's what I appreciate in what you are doing, you guys. Please,
Oh,
Dr. Daniel, yeah, yeah. If you have anything to say, you can go on. Yeah,
yes, in Africa, we like, I mentioned it earlier that we are smart, and
yeah,
when
yeah.
we look at challenges, we look for a way. We quickly look for a way to overcome that challenge in an acceptable way.
Yeah.
In fact, it has gotten to a stage that sometimes we improvise. There was a time that we wanted to do a study, and in that study, we need to monitor the BP of all the animals that we are going to
Mhm.
use. So we fabricated some equipment to actually monitor that. And I
Yeah.
must tell you the truth, the equipment was accepted to the extent that a man came all the way from Abuja to come and look at the equipment. No, that
Yeah,
equipment, you
yeah.
don't need to attach anything to the animal. Just place your experimental animal on the equipment. It will tell you the BP of that animal.
That's interesting. I've,
So
yeah,
we've done a lot in Africa. We are
yeah,
still doing a lot in Africa,
yeah,
and
yeah,
be
yeah.
expecting a lot
And we
from
can do
Africa.
more than that if and only if the
Exactly.
researchers are heard. If the Lambda citizen can also
Hmm.
help and invest in science and technology the same way they invest in music or
In music,
movies,
politics,
etc., etc.
movies.
Yeah, yeah.
Exactly. Thank
They
you.
they trust the Lambda citizen can have in researchers is not yet the same trust he is having right now with
Hmm.
musicians
Hmm.
or people like that. Yeah,
Hmm.
I've
Hmm.
remembered the name of the researcher from Cameroon. Her
Okay.
name is
Okay.
Agnes Tumba. Yeah, Agnes Tumba.
Oh.
She's
Oh,
doing
that's
a
nice.
very, very good job at the University of Douala right now. She received a prize in Rwanda, uh,
Wow.
le prix UNESCO, L'Oréal
Oh.
UNESCO for women in
Wow.
science.
That's
Yeah,
great.
yeah,
That's
yeah, yeah,
great.
yeah,
That's
yeah,
great.
yeah, yeah. That's great. Yeah,
I'm happy
wonderful.
that our work it has been recognized.
Yeah,
I'm happy
yeah,
to hear
yeah.
that.
Yeah, but what is unfortunate is the fact that the recognition most of the time comes from abroad, comes from other continents. It doesn't come really from our own countries or from our own continent, from Africa. If you hear most of the times the awards the researchers from Nigeria receive, or the researchers from other countries
Mhm.
in Africa, these
You're right.
awards come from abroad.
Exactly. Exactly.
Yeah,
I think the reason why it's so is just like I mentioned earlier, we are distracted, and just
yeah,
like you cited earlier. No, we African, we have a strong desire to invest in music, to invest in entertainment, to invest in politics and all that, neglecting science and technology. And we really need to do this in order to support the creativity that we've been
Yeah.
seeing or we have been seeing in Africa. Must tell you the truth, if you check the history of science anywhere in the world, you see blacks being represented. And no matter what, whether as black, you are saying you are black USA, you are black American, you are black this, you are black that. Your origin is from Africa.
Sure. Please, I
Aha.
want to
So
use this. Yeah, I want to use this particular topic to yeah, introduce our last part of the interview to talk about the diaspora. Please, do you think the diaspora is doing enough to solve the problems we face in Africa in the STEM fields like science, technology, engineering, mathematics? What is your
yes.
point of view about the diaspora?
Well, they are trying. Let me put it that way. They are
Mhm.
trying. Although we are not yet there. And yes, we are not yet there. We can't say we have reached the peak. You understand what I mean? But I must tell
Yeah,
you the truth. We are still trying,
yeah,
and I will tell us or leave this message with us that we should continue breaking limits. You understand? We have been
hmm,
breaking limits. I must tell you the truth. In fact, for me to read about a particular African that helps in the discovery of COVID-19 vaccine is something spectacular.
yeah,
And that's what we've been seeing in different fields, even in fashion. I was wowed when I read about an African that she has
yeah,
been the one designing the clothes for
yeah,
Michelle Obama when she was in office.
yeah. That's
so
great.
we so we are trying. I will tell us to continue despite the challenges that we've been facing. You understand? We should continue and keep breaking limits. Thank you.
Wow. Thank you very much for these words, Dr. Daniel Akingbolabo. We hope the
Thank you
people who
very
are
much.
listening us right now have learned many things about pharmacognosy, and that
Wow.
yeah, that's it. Please, can you say anything for us to conclude this interview, please?
All right. Okay, what I just need to say is to encourage all Africans. We shouldn't be looking down on ourselves wherever we find ourselves. We have all what it takes to compete globally, and that we are unique in our own way, and we are creative, and we are strong and bold. So we should continue with that. The spirit of Zakazulu, the spirit of our ancient fathers, we have that zeal. The zeal is in us. We should continue. And another thing is that we shouldn't be limited by what we see. No, let us let me share this with you. In Africa, we have countries
Yeah,
that have developed COVID vaccine, and
exactly.
in the rank of COVID vaccine that have been submitted, it was ranked based on an activity. We have one from Africa that is ranked 68th among the 200 samples that have been submitted.
Yeah, yeah.
Oh, so we shouldn't look down on ourselves. We should continue with that zeal, and one day we'll be at the peak and we'll be recognized. Thank you very much.
Great. Thank you very much, Dr. Daniel. One day, our researchers in Africa will be recognized, but the
Yes, we'll receive
recognition
the Nobel
must
Prize
start
one day.
at home. The
Exactly.
citizens who are not in the scientific field, who are doing maybe who are in other fields like maybe literature or journalism,
Mhm.
must recognize what the researchers in Africa are doing, because every
Yes.
day they are in the laboratory. It is to solve a particular problem in the society. Most of the time, it is to solve our health issues.
Yes.
So
Right.
let us encourage our researchers like Dr. Daniel Akingbolabo. Thank you very much,
Uh,
sir.
all
Have
right.
a
Thank you, my
good
brother.
evening.
All right.
Goodbye. Thank
Thank you.
you.
Goodbye.
Please
Yeah.
like,
Take care.
share, and comment this video. Ciao. Thank
All
you.
right.
Bye.
All right. Bye.